Hi, everybody. I'm Shane Bales for Proactive Sports Injury Clinic. Today, we're going to be talking about Chiros and Physios, some of the ways they overlap, as well as some of the differences that are between them. Often questions come from our patients or even the public. So let's address some of those, and hopefully we can answer any questions going forward. So dochockey, and there's our Proactive Sports Injury Clinic logo. I'm a soft tissue specialist and a chiropractor. So we work a lot with muscles, ligaments, and nerves when we do our treatments, not just adjustments. So what's the difference between Chiros and Physios? So the big difference is license, right? So we see here, license, there's doctors. Chiros are always doctors. Physiotherapists are doctors, or they can be masters, or they can be just have a diploma of physiotherapy. Now, this basically changes things going forward when we're looking at who's basically referring to them and how the insurances see them. So when we're looking at insurance, it's about who the chiropractor or the physiotherapist is, because chiropractor gets put under chiropractic insurance, under private health insurance, and physiotherapy gets put under physiotherapy insurance. So some outliers are acupuncture. So if your physiotherapist or chiropractor uses acupuncture, they can be a practitioner or an acupuncturist. They have to be an acupuncturist to actually be billed under acupuncture. This has changed about a few years ago when they started putting more credentials in for acupuncturists and not just anyone that was sticking needles in people. Now, some insurance plans have $2,000 for a lump sum of all practitioners, and some have $500 per individual practitioner. So if you have a naturopath, if you have a physiotherapist or a chiropractor, they can be under different designations. You get $500 for each, or it can be for everything under $2,000. So that can be really good for some people that use one practitioner, they get $2,000. But when it's individual practitioners, you want to have somebody that usually has multiple of people that they're seeing, like we talked about. Now, people often will ask me, OHIP, okay? Is my appointments covered by OHIP? We're in Canadian health coverage, universal health system. Unfortunately, there's only a few specialized healthcare teams that can do this. Now, there's often a long wait when you're looking at seeing one of these teams, only because everyone's seeking these types of treatments because it is covered. A lot of times they're referred by MDs. So if you want to use that, you might want to get on the wait list to kind of go and see them, but it might take a little bit longer than to get there. And you might want to get this condition or this problem that you have under control quickly and not wait too long. We're seeing this with our bunch of Canadian health systems. We're looking at when we get to see surgeons or specialists, it can take a long time. And sometimes we don't have that type of time, or we want to get going with our lives. And that's where we have our private insurances that cover some of these alternative healthcare practitioners. Now, some stuff used to be covered by OHIP for chiropractic, like it was like $10 or $15, or even for physiotherapy. And these types of services now are seen as essential services, so you don't have to use HST. So our services are straight up, no tax included on those. Kind of like when you go to the grocery store and you buy milk, it's not having an HST on it because that's seen as an essential product that you should be entitled to without having to pay tax. Now, what if my doctor tells me that I have to see a physiotherapist? So they're referring you to a physiotherapist on one of your, like a notepad or whatever. So everyone's like, oh, I have to see a physiotherapist because my doctor said that. And insurance companies sometimes say, well, you need an MD referral to see these people. So physiotherapists that aren't doctors sometimes need to have a referral by somebody. Or a lot of times you see this with massage. You need to have a referral from a doctor to get massage covered by private insurance. So you always want to check out your insurance company, what they say about that, so you know if you are covered for those types of services. Now, chiros are primary care physicians and are doctors, so they can diagnose. They usually don't need a note by anything. There's only rare insurances that actually make you seek a doctor's referral note for that, and they're very minimal amount of those. So most times you're covered. You don't need to worry about it too much. Okay. Third point here, we talk about physicians. They're not experts in musculoskeletal conditions. That's not what they're really trained in. They're trained in more general diagnosis, looking at flus and viral diseases and how to use pharmacological drugs and things like that. So they're not really detailed oriented in that, and they don't do a lot of additional training to diagnose these types of problems. Usually they're diagnosing pain symptoms. So pain down the side of the leg can be IT band syndrome, pain in the back of the leg, sciatica, pain in the bottom of the foot, often plantar fasciitis. without really proper diagnosis. And we all know that with a diagnosis, you need the proper diagnosis to get the proper treatment so that practitioners know how to treat it properly to get you better faster and to the best of their ability. Now, the take-home point to what I'm talking about here is that you don't have to see a physiotherapist, even if your doctor's saying, go see a physio. You can go see any qualified alternative therapist, from a kinesiologist, acupuncturist, chiropractor, physiotherapist, and all those different types of alternative therapists that you have trust in and you feel are experts in their area and can help you the most. Good referrals, we hear about it all the time. Facebook referrals from different groups that people listen to, or even friends, because they're trusted people and they usually have a good idea of how that type of practice is being conducted. Chiros and physio techniques. So if you can see the picture on the side here, you can see that you have chiropractic, you have health, you have back, you even see a physiotherapy that's in there, treatment, medicine, alternative care. Look at the physio down there. You got functional, rehabilitation. Both of them have rehabilitation, injury therapy. They're very much synonyms of the same words for different types of descriptors of these types of professions. So there's a lot of overlap that you'll see. Back in the day, the different dogmas that you see here, physiotherapy was like, oh, they do exercise only. And a lot of doctors were seeing physios in the hospital. So they're very comfortable with referring to physiotherapists just because they've worked with them before. And exercise is a very safe, non-invasive type of technique that is trusted for everybody, basically going to the gym or doing any home exercise that can help with pain, functional, and stability in the joints. Chiropractic, mostly people associate that with as joint adjustments, or people call it manipulation, cracking, snapping of the bones, which we all know it's not snapping of the bones or it wouldn't be very helpful going forward. But that's kind of the kind of pre-thoughts about what that service of chiropractic is. When we look at different modalities, we're looking at exercise. So down here, you can see exercise, joint stabilization. If you're strong around the joint, usually this joint functions properly, and there's not a lot of problems inside causing, dysfunction, inflammation, and cartilage damage, those types of things. We use a lot of active release technique and Graston, which is there to break down scar tissue and adhesion, because adhesion basically doesn't contract well, so it can't stabilize well. It doesn't flex or stretch very well, so we don't have the good flexibility. It can also cause pain. Shockwave treatment, you can see, has a lot of tendon recovery. So we use it for Achilles tendon, elbow, tennis elbow, those types of problems, as well as long-standing scar tissue. So sometimes on the bottom of the foot, you get plantar fasciitis. It breaks down the stuff that's been there for years and has just built up a thick layer of fibrous tissue. Acupuncture, people probably hear a lot about the meridians, chakras, so through the body, they're to break down some of those blockages so the energy flows smoothly, the body's able to heal a little bit better. Neurogenic inflammation as well. So neurogenic inflammation is basically pains being signaled by the nerves to the brain saying there's a problem here. This can become a cyclic pattern so that you're feeling it all the time, even though the pain might go away or the tissue might be in good health. It also helps with heart variability. Some of the testing that's been done or case studies and the research has said that the heart needs variability, so it doesn't beat exactly the same way each time. It has abilities to cope with different structures. So when we run fast, the heart speeds up. When we go slow, it slows down, so it compensates properly for the type of stress that's being put on the body. We often see this with our concussion patients where the heart variability has changed. It goes at a certain rate and either speeds up too quickly or it doesn't slow down quickly enough, and it often can cause headaches and other physical ailments when things change. Kinesiotaping or regular taping, usually it's a postural reminder. So some people put it right along the back so that your shoulder blades are just sucked back a little bit. And it's a reminder not to just kind of slump forward and going forward with that. That's a really good thing for a reminder. It's not healing things. It also inhibits pain. So if you hurt your elbow and you rub it after all the time, you feel the rubbing more than you feel just the pain from the elbow injury. It can be very helpful for stimulating that, but it can be a little bit counterproductive when you're going into sports where you don't feel the pain and you go further and further into putting pressure on that joint, loading the joint, and can cause more damage than it needs to be. Psychologically, we often use dynamic brain a lot with our concussion patients. It helps physiologically, thinking about depression, anxiety, having more brain plasticity can be very helpful it uses different variables from listening to understanding conversations to noticing things visually from details that flash in front of you, which is very good for driving. It helps to cut down on dementia and Alzheimer's, and even driving to be more safe later on in life. So really works on that brain plasticity that we use a lot for people. So it's kind of a new modality that people can do from home, and it's a really great thing. All right, so then we're looking at what's a good therapist. So people are often asking me, so if we're talking about physiotherapists and chiropractors, what's a good one to go see? I find the hands-on manual treatment is probably one of the best. Reason for that is people just heal better with treatment of the hands, right? Manual touch just feels better. It's calming, and people can really feel you get into the problem areas that you're experiencing. It's also good for diagnosing. When I get in there, I can see, does it tissue feel healthy? Does it have a nice bounce? Is it really restricted? Is it really tight because it's protecting against some other pain, maybe in the neck that you get into the trap or down the back? Secondly, you're putting force into the tissue. So the manual therapy, sometimes we're putting directional force. So I might be putting pressure down and then tractioning up, which kind of tells the fibers in there saying, where do I want to accumulate strength and where do I want to break down tissue that's not doing well, so that those tissue that's coming in to repair it knows where to lay down the new fibers, the new muscle tissue for people. Active movements and exercise, it's also a part of force. So when you're putting force in by active exercises and movements, the body knows that's where the stress is and that's where it wants to build muscle tissue and be flexible. Thirdly, we're looking at exam and tests to show value and improvement. All right. So during each treatment, I'm usually showing them the exercises or the exams or tests that are most inhibited by their body. So functional tests, bending forward possibly, and not just doing pain scales where people are like, well, how do you feel? Do you feel a little bit better with pain? And people are like, oh yeah, I feel a little bit better. Because you need to gauge that in maybe more of a scale, like it's 6 out of 10 today, it's 4 out of 10 today, so that people have an idea, not just is there pain or not pain. Because that can easily, by the 5th visit, be like, oh, I'm not sure if it's a little bit better or not. It just feels, from the beginning, I say it is better. But have I been progressing, improving each visit going forward? Diagnosis with a plan or structure is responsible. So diagnosing, like we talked about before, treatment. Is it the right treatment for that type of condition? And structures, what structures are responsible? Am I fixing a joint that's being compressed by certain muscles, and I'm telling you what muscles those are? Is it a nerve entrapment in my leg causing sciatica? So I want to break down that adhesion that's pulling that nerve tight when I'm walking or bending forward or sitting. And often what people are asking is about how long is this going to take? You hear that a lot. Usually we talk about prognosis as in 6 treatments, which is a really easy condition that we can do for 6 treatments. 12 treatments would be a little bit more involved, but it's usually an average of 12 treatments. So most conditions I see is about 12 treatments that it takes to kind of get you to maximum health. And then 20 visits is usually more complicated issue that's going on. It can be multiple joints, or can be structurally a problem. So if you have arthritis or some type of tear in a muscle or cartilage or labrum, then it might take a little bit longer, and we might be putting you on kind of a maintenance kind of program. Take home point, just because when you leave physiotherapy or chiropractic treatment, it might feel a little bit better when you leave, which is the goal, but are you making gains after that, right? Are you returning back to baseline, or are you having improvements that are long lasting? We want to have goals. So what's your goal? Is it just to get a little bit better? You want to be able to touch your toes. What's your goals? So that we're all working towards the same thing. What's the purpose of the treatment, fit the diagnosis, and the plan? How long is this going to take? And how are we going to structure this? Once one test is really good, we move on to the next most important test in my clinic anyway. And I think that's a good rule to go by, so that people aren't saying, well, I'm just going to come back here until I'm fixed. We actually have a base marks that we're going to be looking at. So when you're at maximum health, I can say that these tests are either normal or that's as far as you're going to be able to get at this time. Compatibility with chiros and physios. We have a lot of compatibility in our clinic. We have a physio that comes in during the week. Usually what the chiro is there for is we do the acute care, decrease the inflammation, increase the range of motion, and decrease pain. So often I'll have somebody come in and I'll be like, oh my goodness, oh, my shoulder hurts so much. And I'm looking at it, and they can only get it up to here, and then they have to drop it down. I'm like, okay, no problem. You don't have a shoulder. So we got to get that joint back to be functioning as a shoulder would function. So that's what we mean by you don't have a joint. You don't have a hip. You don't have a shoulder, because it doesn't go in all ranges of motion with full range and strength. So we'll work on strength and flexibility. Now the physios often, after we get it rolling quite a bit, then they can take on more exercise. So if the tissue's doing well, the joint's at its best range of motion at that time, we can start adding in a little bit more load to those joints. They do a great job of strengthening, stabilizing the joint, then moving on to like core stability, muscle, body strength. And they set up a program going, okay, how can we, impact wise? We start with walking, then we go running, then we might go jumping, those type of things, and making sure they're doing it progressively at the right rate and not going too fast where they might re-injure something or cause inflammation that will slow down healing. So we both stabilize and strengthen, but I think the physios take a little bit more attention to detail, especially if that type of physio likes to do exercise and set up programs. They can be more aggressive with the exercise program, where I think chiros will often not have that type of detail. You can do with PTs as well, which is personal trainers. They'll do that for you too, as long as you have somebody that you trust. They work really well in clinics. So having physios, personal trainers, and chiros in the same clinic can be really advantageous for that clinic to help people overall, because everyone kind of responds to different treatments. Sometimes people respond better to the acupuncture treatment that I give. They respond better to the ART or the shockwave. And it's really interesting to see how some people really get better results with different things. And I know it's a great thing to get somebody better that's been struggling with something, even if it's not exactly the most basic way that you're used to doing it. So not just a joint manipulation, but doing some acupuncture or ART that really helps them out. So hopefully everyone can find out that technique that works the best for them, and they can keep using that regardless if it's placebo or it's physical. I hope that answers some of your questions. If you guys have any questions further on about it, please contact us at Proaction Sports Injury Clinic. 613-505-5000 is our phone number. Our email is proactionsportsclinic@gmail.com. Think of us anytime you got pain or you want to get better, and we'd love to hear from you and see you in the future. I'm Shane Bills, Dochockey. Take care. Have a good one. Thanks again.